So we're almost finished. We are putting all of the screws in to stabilize the spine. I'm actually on the last screw on the left side. We call this the S1 screw. It's the very top of the sacral bone. So we've put in the L4, the L5 screws on both sides. We're putting the last screw in now. Once this screw goes in, what we're going to do is we're going to connect this entire construct with a rod that matches the natural curvature of the spine. It's something that's really important. The mechanics of the spine are very important to reestablish. So when a disc is collapsed and shifted, you want to bring it back and extend the spine so that the muscles are in a relaxed position when the patient is relaxed. That has a huge impact on how they feel later on, even when the fusion is solid. You don't want the back to be flat or forward. So we're going to work really hard to get that curve back. We're going to create the construct with the rods to connect these heads of the screws. The discs have been removed. There's a big fragment of disc, and I'll show you that in a little bit on the back table. There's a big calcified fragment of disc that had separated from the parent disc, which is the main disc where it belongs between the bones, and was smashing the nerve. So that's been freed, and luckily we were able to do that without any issues, even though the patient's had surgery in the past. The scar around that nerve sac is really risky because patients can actually have a tear in that thin membrane over the nerves, create a spinal fluid leak, and have persistent headaches and wound issues, and even a risk of infection and meningitis. So luckily we were able to do that without a problem, and we're just going to stabilize the spine and we'll be done pretty soon. Thank you.